Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Hello, welcome to today's presentation, Naloxone, a lifesaver in the opioid crisis, presented by Dr. Zarlakhta Wayand, emergency medicine physician with Washington Hospital Healthcare System, and Jasmine Basrai, Chief Executive Officer with Haller's Pharmacy. First, we will begin with Jasmine Basrai from Haller's Pharmacy. Jasmine is here today to deliver some important information about access to Naloxone. Please welcome Jasmine Basrai.
Thank you. Hello, I'm Jasmine Basrai, CEO of Haller's Pharmacy and Medical Supply. Today we stand as community partners with Washington Hospital to address the epidemic of opioid abuse and overdose. We have a choice. We can ignore it, shame those who have fallen victim, or confront it head on. My family became a part of the statistics we never thought we would be. My brother Joshua wasn't a fentanyl addict, but knew how it could help him end his life and how accessible it was. In his last moments, he was smart enough to know that his life-saving medications like Naloxone and Narcan were available. If he decided to change his mind, they could have saved his life, but they weren't. This isn't an issue just of drug abuse. It affects everyone in our communities. Whether you know it or not, there are opioids in your house, in your medicine cabinets that could be misused, leading to fatal consequences. In today's presentation, you will learn more, especially about Narcan and Naloxone. Currently, this life-saving medication can have a huge impact on our community. It's available over the counter, via prescription, and free through our relationship with the National Coalition Against Prescription Drug Abuse, or NCA-PDA. It's a nonprofit that's available to treat these harm reduction techniques. All of these resources can be found in this presentation or at our pharmacies. Our staff are available to make sure you get trained on how to administer this life-saving treatment. This epidemic isn't just someone else's problem. It's something we all need to be aware of and help. Now I'll turn it over to the doctor to tell you more about what we are facing.
Thank you, Jasmine. Now I would like to introduce Dr. Wayand, emergency medicine physician with Washington Hospital Healthcare System. Dr. Wayand is a board-certified emergency medicine physician currently practicing in the San Francisco Bay Area. Dr. Wayand trained at University of Texas Southwestern Parkland in Dallas, Texas, and received her medical education at University of Miami in Miami, Florida. Please welcome Dr. Wayand.
Hello, I'm Dr. Zarlakhta Wayand. I'm a board-certified emergency medicine doctor here at Washington Hospital in Fremont. Today, our topic of conversation will be Naloxone, a lifesaver in the opioid crisis. So let's begin. Let's start off by talking about what opioids are. So what are opioids? Opioids are one of the oldest known pain medications. They're used to alleviate anywhere from moderate to severe pain. They're derived from the plant opium, as I'm sure you're all aware of, and it's also available in synthetic forms, in other forms, not just the opium forms. So some of the most common opioid medications that are available at this time, prescription as well as on the streets illegally, as you all know, would be some things like morphine, Dilaudid, Norco, Vicodin, fentanyl, and street drugs such as heroin. So what do opioids do? The goal of opioid medications are to alleviate pain. Unfortunately, with these medications, there's a really high risk for abuse and physical dependence. Some of the common side effects with any medicine, including opioids, some of the benign ones that we know of and we could easily treat are side effects such as constipation that we could give patients medications for when they're prescribed opioids to alleviate that side effect. Sometimes it can cause drowsiness, so we usually recommend that patients not drive car or operate heavy machinery. It can also cause symptoms such as nausea and sometimes vomiting that can also be medicated and given medications for. Some of the unfortunate other side effects are tolerance, means patients require a higher and higher dose of this medication to give the same amount of pain relief. And sometimes these medications can cause physical dependence, means your body is dependent on these medicines. If you don't take them, you don't feel really well. Some of the life-threatening complications and side effects that we're going to focus on today and things that you can do to help with these life-threatening side effects are respiratory depression and sedation. So let's talk about what are some reasons patients overdose or take extra doses of opioid medications are for. Most of the times it's accidental. With older patient population, they're not able to see very well, their pill bottles get mixed up, somebody else is making their pills, or sometimes they'll just forget, so they'll accidentally take an extra dose of their opioid medication. Other times, unfortunately, patients deliberately misuse opioid prescriptions, will take their family members' prescriptions, or they'll take extra doses than they were actually prescribed. Other times, what happens is patients can mix opioids with other stuff, such as over-the-counter medicines such as Benadryl that already causes drowsiness. It can worsen your drowsiness when you take opioids. If you take alcohol and opioids together, that can also cause respiratory depression and cause more drowsiness and worsen the symptoms of opioid overdose. Or mixing it with prescription medicines such as Xanax, Ativan, Valium, etc. And sometimes it's mixed in with other medicines or used as the medications or drugs that are available on the street illegally. We are facing a national epidemic right now. According to the CDC, more than 1,000 people in California alone are treated in the emergency departments for opioid-related overdoses or opioid-related complications. As you've heard in the news, about 3/4 of new heroin users have reported using prescription opioids prior to using heroin. So they started off as prescription medications and then eventually they went on to using heroin once the prescription medicine was not available, and sometimes it can go on to using fentanyl. The overdose rates and mortality in California has increased at a faster rate than any other states. I think there's like 130% increase in mortality related to opioids used in California in 2022 alone. So I'll continue to throw some numbers at you because this is very serious. I want everyone to understand the gravity of the situation. This is a very serious crisis to be facing and things we can do to help with this crisis. So in 2022 alone, 7,000 Californians died from opioid-related overdoses. The California National Guard seized about 28,000 pounds of fentanyl in 2022 alone, which is about 600% increase in seizures from the prior year. More than 120,000 deaths were reported in the U.S. In 2023, which is a huge number. If you think about it, that's like a population of a small town. And 64% of these deaths were due to synthetic opioids such as fentanyl. We will talk a little bit more about fentanyl in our next slides. So fentanyl is mainly smuggled into the United States from China, Mexico, and India, and it comes in either a powder form or a pressed pill form. So just to show you how serious the situation is, a 5-pound bag, which is a very small bag, as you can imagine, a 5-pound bag of chicken, which is not very large, is enough to produce lethal doses for about 1 million people. So this is something very serious. We have to be aware of it, raise public awareness regarding this and what we can do to prevent this from happening. So I have a very good picture here, which will show you a small dose of fentanyl, which is only about 2 milligrams at the tip of a pencil. If you see how little this amount is, it's very shocking to see this is actually enough to kill a person. And this is life-threatening and very serious. So what is fentanyl? Fentanyl and its analogs, they're the primary drivers currently of death of the opioid overdose crisis right now. More than 60% of patients that are dying of the opioid overdose are related to fentanyl. Fentanyl is 50 times stronger than street available heroin and almost about 100 times stronger than prescription morphine. So very, very strong medicine. People are not aware of it. Sometimes they will take it thinking that it will be just as strong or just slightly stronger than heroin without realizing the serious consequences. Over time, people can develop tolerances to these medications, and because of the tolerance, they think they can handle a larger dose of fentanyl, and that can also lead to death. Overdose, the different forms that people can overdose is through ingestion, injection. Ingestion means taking the pill through their mouth. Injection via injection, it's very self-explanatory, or inhalation by through their nose, they'll inhale it. One of the misconceptions that's going around in the public is that overdose can be, fentanyl can be caused by touch through exposure through skin, but that is not the case. I think there's some news stories in the media about people touching fentanyl and overdosing on it. Most likely what happened in those circumstances, as you saw in the previous picture, how little amount it took for an overdose, that person might have touched some fentanyl and then touched their face, touched their nose, causing the overdose, unfortunately, in those cases. So how can we help with this? Is we can help with the administering them Narcan, but sometimes the fentanyl, it can be longer acting, means we might have to give a patient multiple doses of Narcan to have the same effect where they reverses the effect of fentanyl. In the hospital, Narcan or Naloxone comes in multiple different forms. In the hospital, we sometimes have to put them in continuous IV, means intravenous drips to have the same effect to keep the patient awake and breathing and reverse the effects of opioids. So I have a couple of pictures here to show the street available counterfeit versus real oxycodone here. As you can see, they try to mimic these comparisons and they make them look very, very similar to each other. So a person buying stuff not from a pharmacy but buying it on the streets could be easily fooled by thinking that these might be actually the real medicine and not something that could be potentially laced with fentanyl, something that could cause death. I have another slide to help understand the importance of awareness in the general population. The trends in opioid overdose among the U.S. adolescents between January 2010 and January 2021, you see there's like an extremely high spike in fentanyl overdoses alone. So it affects everyone. It affects younger children, and it's been affecting younger adolescents a lot more than it ever has in the history of drug use in the past. They try to make it in little pill forms such as rainbow fentanyl to attract or appeal to the younger population. As you can see, there's like or sell it to them under a pretense of a different drug, but it could still be laced with fentanyl and could still have the same serious consequences of fentanyl overdose. So let's talk about what you can do or I can do to help save someone's life. So the number one most important thing would be to identify opioid overdose. The second thing, we were going to talk about that in detail, would be how to administer Narcan or Naloxone, and what do you do after you call 911. Okay, So the first thing, you identify an opioid overdose. You'll see that the patient will be somnolent, meaning they'll appear more sleepy, they'll respond a little less than they normally do, their breathing will slow down, their heart rate will slow down. If you take a look inside their pupils, you'll see that the pupils are pinpoint or small, very, very small. If it's been a while and the opioids are working on them, their skin will turn cool and clammy. And if their oxygen levels are low, you'll see a bluish color around their lips. That's when we know that they've most likely are having an opioid overdose. In this slide, you'll see that their breathing slows down, their breathing stops eventually, there's lack of oxygen to the brain, eventually their heart will stop and cause anywhere from seizures to death. So serious consequences. So what do you do? So if you have Narcan available with you and you know how to use it, the next step would be to give the patient Narcan. So the number one step would be to open the packaging. The next step is put the nozzle between your two fingers and administer the Narcan into the patient's nose. It could be either nostril, as long as it's not obstructed by anything, and then you push the plunger and you administer the Narcan like in this picture right here. So what to expect when you've given someone a dose of Narcan. The best thing or what your goal is so that to see the patient wake up. So you'll start seeing the patient waking up. There could be some mild agitation. It's like they're in a deep slumber, you're sleeping, and then you just really shook them and you woke them up really hard, so they might be slightly agitated. They might have some nausea, some vomiting. These are all good side effects. You saved someone's life if you see all of these things when you administer Narcan and they respond. It takes about 2 to 3 minutes for the medication to work, so be patient, and then while you're waiting on the medicine to work, you're going to call 911. So what happens while you're waiting on 911 to arrive or paramedics to arrive to help with this is you would lay the person on their side. In the previous slide, we talked about how this can cause nausea and vomiting, so really high risk for choking. You don't want the patient to aspirate or for the vomit to go inside their lungs, and that could make their breathing worse. The next thing would be to make sure the patient's awake and breathing. I would recommend talking to them. You could stimulate them gently, keep them awake, keeping it engaged will keep them awake enough so that they're breathing on their own. And then you stay with the person until 911 arrives. So these are the two pictures of the over-the-counter Narcan currently available right now, or Naloxone currently available right now. Revive is the new brand name that just got approved by the FDA this year to be used in 2024. The other one, very common one that fairly everyone knows about is Narcan, which is the brand name of Naloxone. So these are the two medicines that are available over the counter right now. Just to remember, Narcan was actually not available over the counter until March of 2023. And this is the government's response to the opioid epidemic. They saw that so many people, young people especially, are losing their lives because of opioid overdose, and something very simple as administering Narcan can save their lives, so they went ahead and approved it for over-the-counter use last year in 2023. So what is Narcan? Narcan is a life-saving medicine. As we talked about, it was approved by the FDA to rapidly reverse opioid overdose. It is what we call an opioid antagonist, or that means it binds to the opioid receptors in your body and basically blocks or reverses the effects of opioids. So it's basically fighting and doing all the things that opioids are doing, but the opposite. So the opioids will repress your respiratory, Narcan will make you breathe faster, opioids will make you sleepy, Narcan will wake you up and make you more responsive. So where is Narcan available or Naloxone available? It's available all over the US right now over the counter. You can access it through California syringe service programs. You can also access it on websites such as nextdistro.org. There's some no-cost or low-cost pharmacies such as CBHS Pharmacy in San Francisco, and it's also available at Holler's Pharmacy here in Fremont, where they will also train you how to use the medicine. Just a reminder, when you do use Narcan and administer Narcan, you are covered under the Good Samaritan law. That means you're protected from civil and criminal liability when you're responding to an overdose, as long as you're doing it to obviously save the patient's life. You do not need to fear for arrest for possession or having any paraphernalia. So if you think someone needs Narcan and you go ahead and administer it, I think that's the best thing you could do to save their lives. How do you store Narcan? Like any other medicine, it doesn't need any special refrigeration, no special packaging. Always with any other medicine, you want to keep it in cool places. You want to protect it from light, and you want to keep it inside the box until it's ready for use, and you don't want to freeze it. That's it, the talk for today. If you guys have any questions, please go ahead.
Thank you, Dr. Wayand. We do have some questions today. The first question is, can you harm someone by giving too much naloxone?
That's a very good question. The simple answer would be no. So if you see someone who's unresponsive, they're not breathing, and you give them Narcan, and if they do respond or they don't respond, even if they're not unresponsive from Narcan, it's not going to have any side effects on them at all. So absolutely no side effects. Please be generous when you give it, and you don't have to worry about having any serious or negative side effects on them. So please do.
Thank you. The next question, can it be dangerous for children?
Like any medicine, I would keep it away from children. But if the children, sometimes some children are actually started on opioid medications when they have cancers or something very serious where they're in a lot of pain, they are prescribed opioids. You definitely can give opioids to children as well. No harm in giving it to them. But if they do get into a bag of Narcan or Naloxone or a box of something they're not supposed to be, I would consult with your poison control or your physician.
And thank you. And our last question, who should have Naloxone on hand?
In my personal opinion, I think everyone should have Narcan. I think the incidence of Narcan use is using among the youth, so I would recommend Narcan in schools, in gyms, in public libraries, anywhere there's a huge population of people, airport, on your personal use for your family members and for your own use if there's a risk of you overdosing or mistakenly overdosing. So anyone and everyone.
Thank you. This does conclude our program. We would like to thank Dr. Wayand for this insightful presentation, and thank you, Jasmine and Heller's Pharmacy, for providing affordable access to naloxone in our community. And thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on our Facebook page and YouTube.